Hi, I'm here with Dr. Siddarth Sethi, Gastroenterologist and Hepatologist. And in this video tutorial, we're going to be looking at crush injuries and in particular the back pain that can develop after a crush injury. And in particular, gastrointestinal symptoms is often a difficult one. Did the gastrointestinal symptoms develop after the analgesic medication? Or would they have happened anyway as a result of the injury? So Dr. Sethi, could you talk us through crush injuries, how they normally present and the normal trajectory, I guess, of the development of the injury and the impact of medication?
Sure. So thanks for your kind introduction and inviting me to speak today. So patients will often be prescribed a variety of analgesic medications after crush injuries, including analgesics, tramadol, Lyrica, Panadol, Panadine, and quite commonly they'll also receive a wide variety of non-steroidal anti-inflammatories as well. So not uncommonly, patients will develop gastrointestinal symptoms shortly afterwards. This may include reflux, heartburn, abdominal pain. It could be irregular bowel habits in terms of diarrhea or constipation. They may often have rectal bleeding as well. So they'll often be referred to a gastroenterologist initially on a medical basis for assessment to undergo gastroscopy, colonoscopy. I would get involved in a medico-legal setting because often patients will lodge claims to arguing or claiming rather that the symptoms that they're experiencing are a result of their medications. So my role would be then to assess that. The things I would consider would be as to when the symptoms started. If there's a long gap between patients being prescribed the medication and symptoms developing, that would go strongly against the medication having been causative. Quite commonly, patients have developed irritable bowel syndrome, which is a very common condition. It affects about 15 to 20% of the population. It's a very common condition. And even reflux or so-called Gastro-Oesophageal reflux, even that's a very common condition. And it's often my role is to determine as to whether they would have developed this condition regardless or whether it's from the medication. I must say the general medical and scientific consensus is that IBS and GORD are usually not medication related. They're often very common and often would have occurred regardless. So the questions companies or insurance companies or lawyers may like to ask me is to how much of do I attribute their gastrointestinal symptoms to their work-related injury? Would the gastrointestinal symptoms have developed regardless whether the injury occurred or not, and often to do impairment assessments. So, in some cases, the analgesic medications can be responsible. So analgesics are well known to cause constipation, and non-steroidals are particularly well described to cause stomach ulcerations. So in some cases, in a variable proportion of cases, the symptoms may well be medication related.
Okay. So in these kinds of instances, in these kinds of injuries, do you have any recommendations for your referrers, your insurers, your lawyers, and so on, around the kinds of questions that are valuable in terms of making determinations around the claimant's case?
Sure. I try and my advice would be to keep the questions as specific as possible and as targeted as possible. So specifically, they should inquire as to whether the symptoms are related to the medication. They should specifically often ask for impairment assessments. I'm often ready and willing to comment on other experts' reports. Not uncommonly, they may have already seen another gastroenterologist. I'd be happy to invite it to comment on the other gastroenterologist report. I'd also be happy to offer my opinion as to whether the condition is causally responsible. And often I would probably recommend they ask me to do a work assessment. So I would advise as to whether the gastrointestinal symptoms would be reasonably impairing them from working, because in a significant proportion of cases, a large number of patients, so gastrointestinal conditions may cause morbidity. They usually should not reasonably restrict a patient from working. One should still be able to work regardless of whether you have reflux, heartburn, irregular bowel habits. It normally shouldn't stop someone from working.
Okay, that's great advice. Okay, thank you, Dr. Sethi. Of course, Dr. Sethi can be booked directly through the MEDirect booking platform, and he would welcome any conversations, any any questions that you might have regarding the suitability for Dr. Sethi's medical advice regarding any of your injured individuals. Thank you, Dr. Sethi.
Thank you, Sue.